Hello, welcome, and thank you for joining us today at the Ashoka Changemaker Summit Community Conversations, A New Togetherness. If you've been following us for the past couple of weeks, you'll know that this is our 6th installment in the Community Conversations, and today we're going to be talking about health. And more specifically, we're going to be unpacking the new paradigms in health and the future of healthcare. We're going to be talking about healthcare, health access, and well-being, and how social entrepreneurship is playing an important role in these new paradigms in health. If you are also joining us on Swapcard, then following this conversation, you will be able to participate in some conversations with us after the panel. So I will give you some more details about that to come. So look out for that. But I want to say a welcome to and a thank you to our 3 guests, our 3 panelists this morning or this afternoon, depending on where you're joining in the world. So I want to say thank you and welcome to Dorica Dan, the founder of the National Alliance for Rare Diseases in Romania. Thank you for joining us today. I want to say thank you to Neo Haturi, founder of Technovera, who is also joining us today. Thank you for being here. And I want to say thank you to David Strelnick. Sorry about that. David Strelnick, founder of Nourishin and the Nourishment Economies Coalition, who is also joining us today. I'm so excited to have this panel. I'm really excited to dive into these conversations. So let's get started. When we say paradigms, what do we really mean? We mean new patterns in health, new patterns in healthcare, and what this really means for the future of health and health access. So I want to start with Neo. If you could tell us a little bit about the work that you do with Technovera and the new paradigms that you are working with in healthcare.
Thank you so much for that opportunity. So our organization is based out in South Africa, and the challenge that we've been tackling is a scenario where within the public healthcare system in Southern Africa, you find that patients who are on chronic medication such as HIV, hypertension, diabetes, so any condition that requires patients to have a repeat prescription being filled on a monthly basis, experience a high volume of or experience long queuing times at public healthcare facilities when they have to go collect their monthly treatment. So a patient can be waiting anything from 3 hours in a queue to about 5 hours from queues on high volume facilities. The focus of our work has been around how do we build technology that effectively increases capacity at some of these facilities by effectively enable patients to collect their medication quite quickly. And these are people who are managing a long-term sort of condition. And the solution that we've been working with in the ministries of health in Southern Africa is a solution called Bellebox. What it is a digital locker that enables patients to have their medication preloaded into these bank of cubicles. It would then send an SMS to a patient saying, Dan, your medication is ready for collection. Here's a one-time PIN. The patient would be able to build in their collection cycle into their own daily life for them to be able to access their treatment. At the moment, we've been able to show that we're able to take a patient from 3 hours in a queue to under half a minute in front of a technology that we're building. The paradigm that our work contributes to is obviously moving patients from this idea of, my health has to be managed at a health facility. We want to move people from sick care, from I'm already in a scenario where I have a condition, towards a movement of people wanting to be able to integrate health directly into their life, where the push is towards prevention, the push is towards management, the push is towards early diagnosis, and the push is towards making sure that health is integrated into people's daily life instead of a health visit feeling like it's a chore. It only happens at a healthcare facility.
Thank you so much. Very inspiring. And this transition from sickness to wellness and well care and prevention is really exciting. So we're definitely going to get back to you for more questions, but I'd also like to turn it over to David from Nourishin. Can you please tell us a bit about the work that you've done, the work that you've created, and then the new paradigm for the future of health that you're working in?
Thank you. Yeah, so happy to be participating and learning today. So we are an international coalition of enterprises, of social and business initiatives that are all built around the benefits that result when you connect nutrition, the nutritional health of a person, to the nutritional health of the land and of ecosystems. And so there's sort of an insight that we learned over, more than 10 years, I think, working, with other social entrepreneurs all over the world about how you might start up, inspire, and sustain, local change making. And the insight we found after a long time, the pattern we began to see was that over and over and over again, social entrepreneurs were grabbing the health benefits, the healthcare benefits, the food system benefits, the clean water benefits, the biodiversity benefits, the economic development benefits, the local sense of agency benefits that come out of getting human health and environmental health to work together, and a very local factory of benefit production. And so we worked for, gosh, a long time to try to articulate this. What is it we're actually seeing? How do we describe it? And we've ended up using language around what we call nutrient value chains and nourishment economies. But basically, the insight there being that we're now working to try to help spread in the world in a number of ways we could discuss. But is that great things happen for human well-being at the level of sickness, at the level of maintaining health, at the level of addressing current and historical trauma, at the level of maintaining the ecosystems that we all depend on, through some pretty simple actions that are best handled locally by local people seeing opportunities and moving on them. So there's shift to wellness, to maintenance of wellness. It's quite clear, and there's obviously integration of the health of people with the health of the world.
Thank you. Thank you so much for sharing that. And I'm really excited to talk more about that shift of wellness, and that shift from thinking of health just from the paradigm of human health to the paradigm of one health for environment, for people, for our ecology, and how that connects. And then last but definitely not least, Dorka Dan, who is the founder of the National Alliance for Rare Disease. Can you please tell us a little bit about your innovation, your social innovation, and then the paradigm shift, the new pattern in health that it's really addressing?
Thank you very much for this opportunity. I'm representing patients with rare disease and rare cancer in Romania. And what we are doing through three organizations that we established in Romania, Romanian Prader-Willi Association, because my daughter has Prader-Willi syndrome, and then Romanian National Alliance for Rare Disease, bringing together 48 national organizations, and Romanian Rare Cancers, because patients with rare cancer were lost in the system between common cancers and rare diseases. And we are also working at European level, and I'm a board member of EURORDIS, European Organization for Rare Disease, and we are part of Rare Disease International. So we are trying to solve the problems of patients with rare disease, providing services through Romanian Prader-Willi Association and Neuro Center, which is a pilot center for rare disease in Romania, and it was accredited by Ministry of Health as a center of expertise for rare diseases. And we are trying to shift from a service provider to policymakers, and to communicate with policymakers and create policies for patients with rare disease in Romania. So we have a national plan for rare disease in Romania since 2008, and since 2014 it is part of the national strategy for health. And now we are fighting together with EURORDIS at European level to push for an European action plan for rare diseases, because the previous action plan is now so it is no more actual. So we have to update it, and there are a lot of progresses established, especially in genetics and in IT. And so we are involved at local, national, and international level. And we are trying also to bridge the gaps between social, medical, and educational services for people with rare disease, because people with rare disease need interdisciplinary approach and integrated care. And in fact, there is no communication between these services. Also, we want to reach out the patients which are more vulnerable and isolated in the villages. And we are training community nurses to become case managers for patients with rare disease in Romania, using ECHO methodology, extension of community health outcomes. So this is our approach to bridge the gaps between health, social, and medical services in Romania.
Thank you. Thank you so much for that. Really, really inspiring. And I'm going to stay with you for a bit because from what you shared with us, there's a huge community approach to the work that you do. You have several different communities and actors playing a role in this shift for patients with rare disease. What role do you think community-led and community-centric approaches play in creating new patterns in health? How important are they?
I believe in the support of community networks because we in these networks, we all learn and all teach. We have to learn how to transfer best practices and debate around concrete complex cases, how to find solutions together, where to orient the patients, and to be close to their home, of the patient's home. So this way we can contribute to extension of community health outcomes. So the role of community networks is very important, and we have to bring together all the stakeholders that could contribute to improve the situation of patients with rare disease, but also people with disabilities and other patients, chronic disease and elderly people. This is a model that could actually work everywhere in a lot of settings. So now we are organizing online training courses for community nurses, and we choose concrete cases, and we look for finding together solutions, assessing the needs of the patient and trying to orient the patient to the right services that the patient needs. So this is how we do, and I think it works, and it has a lot of potential.
Thank you. We all learn and we all teach. Really, really profound way of talking about how important community-led and community-centric approaches are creating change for access to health. I want to direct the same question actually to David. And I want to, so again, what is the role that community-led and community-centric approaches play in these new patterns, particularly to the work that you're doing with Nourishing, but then also how do you trigger community leadership? It's not always easy really to place a community approach when we're shifting from the old paradigms to the new.
Yeah, thanks. Actually, your second question is where I get really, really excited, because what we found is that in what I called an insight earlier, the storyline that we talked about, when we're able to put that in front of people in a new community, the reaction has been phenomenal, mind-blowing. I mean, one of the biggest problems I have in my organization is that we have such strong community feedback when we've done several things that we get almost overwhelmed with the enthusiasm of the reactions, and so and the desire for community around these kind of topics, further community connections, right? So how does that happen? I think what we see is that with a simple framework that basically says, look, nutrients go in cycles between people and the earth. And we can talk about the science of that. And we can go very deep into the science of that, but it's pretty simple. Look around your community and look for places where either ecosystems are nurturing the soil is growing food is being produced for people are eating food, and waste is being produced. And waste is either being discarded into a river or into a pipe or somewhere else, or, and this is human waste, this is food processing industrial waste, this is agricultural waste, right? Or it's being recycled back into the earth again. You say that, it kind of makes sense. And then the magic is when we start telling stories of social entrepreneurs around the world who've taken all the good results. We tell the story of, gosh, dozens of Ashoka Fellows in, Haiti and Zambia, Western Ireland, Belgium, the United States, and tell a few stories about what local community changemakers did with this insight. And suddenly the audience begins to bubble with their own ideas. And that's where we get really excited. So I give a quick example. We convened nine social entrepreneurs. I think 7 of them were Ashoka Fellows and 2 others from different countries in the US state of New Mexico a couple of years ago, along with about 15 or 20 local community participants for a couple of days to sort of connect the dots between what any of them were doing in school systems, in restaurants, in farming, but all around nutrient flows. And we had the great honor of an indigenous Navajo medicine man welcome us and point out to us in writing that the word food and the word medicine is the same word in their language. It's the same word. It's not, they're not related. It's the exact same word. And when you back out of that, sort of what we're saying is that, and here's stories of how people have taken that insight, that connection of life in the earth and life of people, and begin to channel it in new directions. We, the social entrepreneurs, need to sit down and be quiet at that point, because the community members sort of rose up and started, coming up with crazy, awesome ideas. 3 years later, we've now got 11 new initiatives in the Navajo Nation in the United States that didn't exist before this meeting, that are all community initiated around these kind of topics. We're very excited about. So there's an aspect of science interfacing with storytelling around change. So
science interacting with storytelling around change making, and it really sounds like the convening of these different segments of the community is what triggers that storytelling, and then triggers this leadership in community-led approaches. Thank you so much for that. I'm going to turn to Neo, but before I do, I have another question for you, but I want to remind anyone who's watching right now to please put your questions into the chat function if you're on Swap Card. If you're not on Swap Card, you don't get to use the chat function, so go on to Swap Card. And put your questions in there, and we will be able to ask some of our social entrepreneurs questions that are coming from the community. But Neo, I want to go to you, and your work really is obviously inspiring, but it also really seems to center around taking the kind of inaccessibility, the highly professionalized kind of old paradigm of accessing healthcare and democratizing it, making it more accessible so that people can have better access. And I know that you use kind of technology in the work that you're doing. What role does technology really play in these new patterns? And you can refer to it in reference to your work. Is it just a tool? Is it more than a tool? How does it get applied?
Yeah, I think for us, definitely, it's been very interesting to see how different communities look at defining technology, whether as a tool or whether as a as an enabler that effectively facilitates a particular process. And I think maybe going back to these shifts, right? When we think of accessing Schedule 4, 5, or 6 chronic medication, you embed that particular process within a pharmacy that effectively exists within a healthcare facility where the person has to be sick, effectively going out to speak to a pharmacist who's very knowledgeable about the medicine and engages that particular patient. Now, you imagine a person who is managing a lifelong condition, who's, let's say, chronically stable, they've been taking this condition, and you still subject them to the challenge of having to effectively embed their wellness into a healthcare facility sort of model, and the inefficiencies or the oversubscribed challenges that comes with that with that model. You shift that completely and you say, but what if the wellness or the person's ability to integrate their condition and how they manage it into their daily lives could effectively be spun around. And I think that's where for us technology has really enabled approaches that effectively build supply chains or value chains that effectively put the person's well-being or the person's wellness at the heart of what you do. You are then able to say, but should they really be still collecting their medication at a healthcare facility, or should effectively the medicine come to a convenient point which exists? I think it's also about starting to really redefine healthcare and say, here are new models such as online retail. You're able to buy an item on Amazon and get it delivered to you. Why is it that from a wellness perspective, we still embed health and well-being in the context of a health facility? And I think it's the ability to borrow from different principles and different technologies that effectively enable us to be able to change how healthcare can work, and more importantly, how accessible it can be. If you have a digital locker that can be used for online shopping, but you can have a similar digital locker that can be retrofitted for chronic medication collection. And I also think that I mean, COVID has sort of also took us on this journey of being able to understand, the power of a community healthcare model where you want to be able to really push decentralization and make sure that health and well-being happens at a individual and at a community level versus have it happening at a healthcare facility level. And I think maybe the last point that I would like to sort of add to that is, you see different layers of technologies that are very much permeated, that have ingrained themselves into how we work, how we communicate, and you start to say, but why do we still exist in a model where a health facility is still sitting with this person is vaccinated, this person is on this condition, this person has been taking their treatment, versus that person's health and well-being starting to reside with the client or with the patient. And I think those are the elements that technology enables for us to really start shifting towards where health and well-being sits with the individual. It sits at a community level. It is not centered around a knowledge base such as a pharmacist, who has to still be integrated into the process of accessing their medicine. I think there are different principles within health and well-being within the traditional specialist approaches that needs to still remain. But I think there is a push towards saying, if we are really improving access, how do we make sure that it happens at a local level? And I think technology has a very significant accelerator or lubricant towards enabling that and very much catapulting it.
Thank you. You touched on so many things, and you almost jumped ahead of the conversation a little bit with the recent pandemic and COVID. So we're going to go back to that. But I'm really fascinated by some of the things that you said, and particularly around pushing decentralization and moving almost the experience of health outside of the traditional healthcare facility. You really talked about that it's almost like a mindset shift, both on the patient side or the person, the consumer side, and on the care side. Could you speak to that a little bit more? How important is this mindset shift to no longer see yourself having a good health journey by accessing traditional models of health?
And I think I really like that framing, because like for us, it's very much been a journey of, like, for instance, how do you get a pharmacist who's, a very well-trained professional within the healthcare fraternity, being able to say, I don't necessarily have to do all parts of the value chain. Some parts of how somebody accesses their treatment can happen at a community level. And I think that transformation from a caregiver perspective, being able to say, look, we are challenged by healthcare that is overburdened, that is sometimes oversubscribed, and where the knowledge is effectively sitting with the professional. And then being able to say, but how do we get a client to be able to really sit with I really understand why it's important for me to effectively have from an HIV perspective, to have my viral load suppressed. Why is it important for me to manage my nutrition and my food intake perspective? And I don't think a pharmacist has enough time and has enough pharmacists who are supposed to be seeing, 40 patients on a daily basis, is not able to provide that level of care. And I think it's when you start to integrate health across all of the different spheres, where a community healthcare worker, for instance, can effectively be a first point of contact when it comes to the knowledge that a client may need. And I think it's about moving the knowledge from certain pools or pockets and effectively making it very, very much available, and effectively pushing it down the value chain to different layers of care. But I also definitely want to say that I definitely feel that the movement is sort of orientating towards me as a person, effectively being the most significant custodian of my health and of my well-being, and effectively interfacing with the different providers or healthcare professionals or healthcare specialists, but everything orientating towards the individual. And I think that shift is drastically important. If we don't achieve it, we don't move from sick care to well-being.
Thank you so much. Really great insights. And me or us as the individuals being the sole custodian or the primary custodian of our own health, and then interacting with the different opportunities, pushing, the access chain to be decentralized. You touched on COVID, so I'm gonna go there. It's hard not to when we talk about health these days. And I'm gonna turn to David first, and I want to understand from your perspective what the recent pandemic, what you think or what you believe the recent pandemic has done for our understanding, the general public's understanding of what health now means, what healthcare means, in these new patterns of health.
Yeah, thank you. It's complicated. I think that there's clearly a sense of need for local resilience, local involvement, local multiple redundant paths of action. I think that's something that COVID has clearly taught us, is that we shouldn't rely on the one centrally controlled system that could either break structurally or because of power relationships. And so that's really important in our work, and in the aspect of our work that has to do with food systems as well, right? So a huge burst of activity around community-based, locally based redundancy and food and nutrition supplies, right? Another really interesting thing I see is that, which was completely unexpected, was that some of the community initiatives we get to be involved with, and a couple that even started up through our work, that thought they were about just that, local food systems, the connection between local farming, product supply, and the economic forces that are driving the dynamic we're talking about. What I mean by that is the desire for local economy, local sense of agency, for cultural relevance in how we conduct our business, including our foods. I mentioned food, all of this, because when COVID came and the need for distribution of relief supplies and health and medical services came, it's amazing how many of the community-based networks in our system that were focused on food flipped over and became the service providers for COVID relief supplies. It actually kind of caused a problem with some of our food-based initiatives, because they left the spotlight because they had built local infrastructure, local distribution systems, and locally motivated people. That's the key, locally motivated people ready to step up and get the products to the people, to the communities, way faster than any central structures were prepared to do. And then the third thing I would highlight, is There's certainly more attention being paid to where diseases and viruses come from. And so to the degree that some people think that COVID emerged because of environmental conditions that biodiversity loss and ecosystem conditions that were degrading. A lot of people are like, well, then we better, for purely for reasons of human health and survival, we better start taking care of the environment a little more, right? So there's momentum on that front as well.
Yes, definitely the momentum, or at least the awareness and understanding of really how connected we are to our environment. I know it might sound, kind of obvious to say, but I think, the fact that there's still debate happening around the world means that something like the pandemic probably did turn some other eyes open to the need for, ecological preservation. You have a really extensive background in working at policy level as well, both nationally and internationally. How do you think, and maybe, this is a little bit off the cusp, but how do you think policy needs to adapt or change in order to help these new paradigms flourish, paradigms that allow for decentralization, paradigms that allow for community-led initiatives, paradigms that allow for us to be able to preserve our environment better?
No, thanks. I mean, it's a really important question, and I don't have the answer, but I think it's reflected in the words you just used. Paradigms that insert the word policy instead of paradigms. Policies that allow for decentralized action, right? Policies that allow for different approaches. Policies that are established around principles and outcomes, wellness, and don't necessarily try to prescribe in all cases the single approach to achieving that principle, right? Policies that filter decision making, legislative, legal, financial, regulatory decision making, right, against a central principle. Hold the principle up. The principle is wellness. The principle is One Health, right? The principle is not a financial bottom line. It's a life bottom line, which financials may reflect, but flip it around and stop using the money to represent well-being when in fact it's not the case. That's where I tend to go with that question. I would highlight another real honor in my work is that I get to work with these communities in different places, including some tribal communities in eastern Zambia in Africa, some Native American communities, and mainstream Western US policymakers in Washington, D.C. I want to highlight that the real inspiring work in terms of governance and policy that I see is coming out of those remote parts of the world. I think the opportunity is massive for Western society and for the US in particular to be learning from governance mechanisms elsewhere that are willing to stick to core values and principles to guide the governance decisions they make. I guess I would say one more thing. How do you do that in public policy? It's hard. It's confusing. There's oversight and there's corruption and there's all this stuff, right? In my experience, one thing I would encourage policymakers who might be listening to do is to let the people innovate, hold to the principles, provide the resources, and don't try to control what's going on the ground, because we're not very good with a whiteboard from a long ways away in a big city figuring out what's going to actually create resilience and vitality in a community somewhere. So create a policy framework that enables that kind of action.
Let the people innovate. Let the people innovate, and not using a financial bottom line, but a life bottom line as guidance for new policy. Really, really insightful. Dorica Dan, I want to come to you as well and kind of merge both of these questions a little bit, because I also know that you work very much at policy change, policy level. That's core to what you're doing. So I want to understand from you kind of what policy changes you think need to happen in order to uphold some of these paradigms, but also, so this is kind of a two-part question, the effect of the pandemic and maybe how that has shifted, maybe it hasn't, the policy changes that you think now need to happen versus what happened pre-pandemic.
I think that pandemic have shown to all of us how important is empathy, solidarity, resilience of the healthcare system. And the most important shift that should be created in healthcare is to move to an integrated care and holistic care, because people need holistic care. And in order to happen this, there is a need of communication, trust, collaboration between health, social, and educational services. And most of the member states or of the states have this very separate, and people are not communicating with each other. So there is a need for more communication, more debate, and more listening, because we need, in order to create policies that answer to the needs of the patients, you need to listen to their needs, not to believe that you know everything that they need, because from an office, for instance. You need to listen to the people and really to encourage debates and find out what you have to do. And of course, pandemic have shown that technology could contribute to reduce the waiting time and to coordinate the care, to monitor from distance people from very, very isolated regions, or to provide therapies, to continue therapies even if you couldn't go out from the house, because you have you had access on digital tools. But of course, we need standardized tools, and we need to see and to assess their impact. And of course, even to create these tools, you have to collaborate and to initiate a platform of collaboration between all stakeholders, including patients. So I think the patient should change their role from, because everybody say about the patient that the patient is in the middle of the healthcare system, but he was never there. So I think it's the time that the patient move in the circle and contribute to his healthcare, to manage his care and to communicate with community and with different stakeholders, and to be trained, to train themselves and to raise their voice in order to show which are their real needs. So this is how I think we should change to create policies that answer to real needs. And in rare disease, for instance, we are working with United Nations in order to show that rare disease are a healthcare topic at global level, because people with rare disease are living everywhere. And there are 350 million people living with rare disease around the world. And this is not a small number. Even if the disease are rare, the patients are not in a low number. So, because there are 6,000 to 8,000 different rare diseases which are not known. And also, during pandemic, people could understand better rare diseases, because they didn't know what is COVID, like in rare disease. They didn't know what treatment exists, if there is a treatment, and where to address for support, which expert in the world know about his disease. This is how it happened in COVID pandemic, and it's the everyday life of people with rare disease. So somehow we have to be solidar and to communicate more, to collaborate and to create networks and networks of networks in order to solve these problems and to have resilient healthcare systems.
Resilient healthcare systems needing networks of networks, really centralized around the patient. really, really inspiring. We are really running out of time quickly. I have more questions, but there's also a question coming in from the community. So I'm going to leave this open to anyone who wants to answer it, but just know that we're really running low on time. So this is from Shafit Khan, who wants to understand if there's a scope for developing countries to emerge as leaders in new roles that help the Western world adopt policies that are more equitable around health. Does anyone want to take on that question? I might assign it if someone doesn't want to. David.
Well, let me just say briefly, there's certainly a role for the leading ideas from developing countries to help clue in the more structured or hierarchical thinkers in some of the developed countries, right? So I don't know if that's a formal role of developing countries taking the lead as much as all of us recognizing that creative, powerful, unconventional, impactful work is happening in places that should inform what we're doing elsewhere as well.
Thank you. Anyone want to add to that? No? Well, I'm going to ask one last question, but before I do, I want to remind everyone that directly following this conversation, we will be moving into an interactive experience for anyone who's joining us on Swapcard or anyone who has the link to the Zoom call, in which we will be speaking with 3 communities of practice who have been working for several months now, and it's a group of diverse fellows representing Africa, Latin America, and Europe, who have been working together to collaborate and understand how they could co-create in these new health paradigms and create a collaborative initiative. So if you're going to be joining us after this call, please join Swapcard, come into the Zoom room, and you'll have an option to either speak with the Africa Diamond team, who is going to be talking about preventable healthcare and COVID, the European Diamond team that's going to be talking about integrated and social healthcare, or the Latin American Diamond team that's going to be talking about health access for all. We have 2 minutes left. I would like to know, what impact do you think these new patterns will have on our future and how they need to evolve? I know that's a long question for the minute that we have, but if you can do 30-second response, each of you, and I'll start with Neo.
I think the new paradigms definitely presents an opportunity for us to really tackle the challenge of equitable access, primarily because they are starting to shift a lot of the systemic structures that have really prevented systemic equitable access for a very long time. I think the idea of putting well-being of the person at the heart of, or at the center of the table, and then building systems around health and around access and around all of these things effectively will improve the equity of that access.
Thank you. Dorica, really quickly.
I think that shifting from sick care to wellness means being healthy in many dimensions of our lives. So that includes the emotional, psychological, occupational, intellectual, financial, social, environmental, and spiritual parts.
Thank you. Ooh, spiritual parts.
These dimensions are interconnected, and one dimension is building from another one. So
amazing.
From the other.
Amazing, thank you. I've heard those interconnections, but the spiritual parts is the new one for me. So thank you for that. And then David, really quickly.
Yeah, let me say the spiritual part is huge. It's a huge motivator in a lot of the work we do. So just as an aside, we should go there another time. I think that the implications of these paradigm shifts are gigantic. And let me just name a couple of ways and be done. But one is, at a very direct level, we're learning so much about how our sickness is resulting from a deficiency in nourishment. And it is local action, local health of the earth that will feed our bodies with nutrients and microbiome connections that keep our immune systems healthy and functioning. And that's not happening unless we shift back to community-based initiatives where people are engaged and resilient and are, you know, managing what's going on the ground where they are locally, which by definition assigns more respect and responsibility and power to the people on the ground. So I think they're headed in really big directions.
Thank you. Thank you so much. And thank you everyone for joining us today. Thank you to my amazing panel of guests, speakers, insights that have been shared today. I'm going to go back and watch this again and steal some more inspiring notes. So thank you, Dorica, Neo, and David for joining us today. And thank you everyone for participating at our Ashoka Changemaker Summit Community Conversations.